Professor Chen Yiping from Shanghai University of Traditional Chinese Medicine gave an academic lecture on the treatment of chronic renal failure with golden cicadas in clinical application and experimental study of Chinese medicine. We know that chronic renal failure is a progressive disease. According to Taiwanese scholars, aristolochic acid nephropathy is difficult to control. Generally within half a year, he has to reach the result of dialysis, right? But our patient, after we use enterochemistry as the main treatment, after the treatment of regular kidney tonic, after a year of treatment, his kidney function has nearly returned to normal. All aspects of kidney disease have improved. So, now we have a wide range of clinical applications. In addition to acute and chronic interstitial nephritis, and IT nephropathy, acute sclerosing nephropathy, then there are some rare kidney diseases, right? Like that dry syndrome, antimycoplasmic antibody syndrome. This kind of disease. In our application, we've achieved good results. On the basis of this research, we conducted experimental research. Then, we've done about 7 or 8 graduate programs. It's a step-by-step process. At first, we determined whether the natural cicada's flower, whether it has any therapeutic effect in animal experiments, and its healing mechanism. And then, after determining that, we used the mycelium culture of cicada flowers. This is a collaboration with Professor Chen Yiping. He provided us with the mycelium of cicada flowers, and then we screened out artificial culture. There are solid cultures, and liquid culture, and we selected the solid culture. The efficacy of mycelium. It's best to build on this foundation. The effective components of cicada mycelium are further developed. So this is the cooperation with the Chinese Academy of Sciences, Professor Xian Li-Zhang, to make it this effective component is confirmed to be the total substance of enterococci type and ethyl acetate. This part of the cloth is the most efficacious. What about the natural mineral part? The results of our results? According to the experimental data, the results of the experiments, it can reduce creatinine and urea nitrogen, increase plasma albumin, improve calcium and phosphorus metabolism. This effect, in our experiment, in the use of Cordyceps mycelium as a control groups. So this is the result. There is no difference with Cordyceps sinensis. The second part of the experiment is on the artificially cultivated Cordyceps mycelium. Just now it was natural Cordyceps. Now, the mycelium of cicada flower is used. He also used the first experiment. It's a model of chronic renal failure created with 5 out of 6 nephrectomized rats. Chronic kidney failure model. So we caused a decrease in his renal function, increased creatinine and urea levels. After the use of enteric mycelium, he was able to improve his renal function. Can be confirmed. At the same time, the mechanism. He found that the mechanism of its efficacy is able to inhibit proliferation of rat kidney cells and increase in stroma, reduces the deposition of collagen and fibronectin deposition. In this way, slows down the process of glomerulosclerosis, the effect of the solid cicadas, then the liquid one. On the basis of the carrier test, we also conducted an in vitro experiment. By inhibiting the proliferation of human glomerular cells, the inhibition of extracellular matrix synthesis was observed. On the basis of this, we screened out the residual flower mycelium. Anti-glomerulosclerosis effective components is the total extract of mycelium and mycelium, ethyl acetate fraction of mycelium. Then the total extract and the ethyl acetate portion of the mycelium. And then through a 5/6 nephrectomy in a rat model. And it's these two components. We're able to lower the levels of creatinine and urea nitrogen. creatinine and urea nitrogen levels in rats with chronic renal failure, and improve renal function and slow down the progression of kidney disease. Its mechanism is to reduce the deposition of collagen fibers in the kidney tissue, extracellular matrix components, such as connexin, in renal tissue. It also reduces transforming growth factor beta-1, basal tissue growth factor, and its overexpression improves renal fibrosis. Let's review to summarize, golden cicadas are superior over cordyceps. It's a medicinal fungus of insect origin, similar in structure. Its flavors in Chinese medicine. One is cold and the other is warm. They are the opposite of each other. So golden cicada flower. It's good for chronic renal hypoplasia caused by various reasons. Chronic acute and chronic interstitial nephritis. It has very good curative effect. So in vitro and in vivo experiments have proved golden cicada flower can indeed slow down glomerulosclerosis, renal interstitial fibrosis. Its mechanism is also more accurate.